You're tired of leaking every time you're laughing, coughing, sneezing, or trying to have a good time, or even exercising, and your doctor tells you, you just need a sling. But wait, what is a sling procedure? Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and I do a sling procedure every week for my patients who are suffering with stress urinary incontinence. But before you let anybody put mesh inside your body, you need to know what is this procedure, who is it for, and what are some risks involved with it. So in today's video, we're going to be discussing just that. So let's get started and stay tuned till the end, because at the end, I'm going to be discussing who should not be getting a sling surgery. And that's just as important as knowing who should be getting it. If you like what you see, don't forget to hit the subscribe button and also share this video with a friend, maybe somebody who's suffering with this problem, and they'll really be thanking you for thinking of them. So what is a sling? So a sling is basically a piece of mesh material, as you can see right here. And what we do for a sling surgery is that we put this mesh under the urethra. So the urethra, which is my index finger right here, is the pipe through which urine comes out. So urethra, which is right here, is connected to the bladder. So bladder is the organ that holds our urine, and then urethra is the pipe through which urine comes out. And when I do a sling surgery for my patients, I do it through the vaginal opening. I make a tiny incision under the urethra and then put this mesh around the urethra so that it can support the urethra like a little hammock. So the reason the sling surgery works is because it provides the support to the urethra so that when you're laughing, coughing, or sneezing, the urethra can close against this mesh material and prevent leakage of urine. So then the question becomes, how well does a sling work? So a sling is one of the most successful surgical treatment that we have for the treatment of stress urinary incontinence. So stress urinary incontinence is a condition where women leak urine with any kind of exertion in their belly, whether it be laughing, coughing, sneezing, exercise, walking, bearing down, anything that puts a lot of pressure on their abdominal wall. In fact, there's very good data that shows that if properly done, a sling surgery can have almost 90% and higher success rate. It's an outpatient procedure. When I do it for my patients, it's literally 15 minutes. We do it with sedation and patients go home the same day. And recovery, honestly, I tell my patients to take it easy for a couple of weeks, meaning no heavy lifting, so nothing more than 10 pounds, and of course nothing in the vagina. But otherwise, they're pretty much living their life. They're walking, they're driving, they're doing their everyday household chores. So really not much restrictions. So I cannot talk about mesh without discussing the mesh controversy. So what is the mesh controversy? So mesh got a bad reputation because some of the older generation of mesh that was used for prolapse surgeries were causing a lot of issues for women, such as causing infections. The mesh material were coming out. A lot of women were complaining of pain with intimacy afterwards. But all this was really in early 2000. A lot has changed in the last 2 decades. And honestly, the new generation of meshes, as I'm showing you right here, I mean, look at this. This is basically the size of my pinky finger and the width of my pinky finger. And these are lightweight meshes, which are very gentle on the body and truthfully very different from the older generation of meshes that were causing a lot of problem. Let me know in the comments section if you want me to do a deeper dive about the mesh controversy, and I'll be happy to do so. But know that the newer generation of meshes, especially mesh that we used for sling surgery, are completely safe and in fact one of the most successful surgery that we have for treating women with stress urinary incontinence. And finally, who is it for? Like we talked about, this is a great treatment for women who are suffering with stress urinary incontinence or mixed incontinence. So who is it not for? Now, there are many women who leak urine because of urgency-related symptoms, not being able to make it to the bathroom, nighttime urination, and leakage associated with that. That's known as overactive bladder. A sling is not a treatment for women with overactive bladder specifically. Now, some women may have what we call mixed incontinence, so they have leakage with laughing, coughing, sneezing, as well as urgency. So a sling can be used for those women, but not for women who just have the overactive bladder symptoms. So my final point, before you say no to surgery or rush into getting a surgery, you need to know what is the surgery about, what is this material, what are the pros and cons of meshes, and who is it for and who is it not for. Hope this video was able to answer some of those questions and most importantly, alleviate your fear about mesh and get you some sort of familiarity about what a sling surgery is all about. If you found this video helpful, don't forget to hit the subscribe button and also comment Sling, S-L-I-N-G, if you want me to do a deeper dive of how I actually do these procedures in 15 minutes for my patients. I'll be happy to talk about the procedure in details, what to expect in the postoperative area, what does recovery look like, and even tell you some of what my patients who have had these surgeries tell me when I see them at their post-op visit. Remember, you deserve to run, exercise, live your life to the fullest without worrying about leaks and bladder issues. And I'm here to help you understand everything you need to know about your pelvic health. So I'll be back again next week with another engaging video. So till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye.